Thank you for joining the How to Be a Good Consumer webinar.
The broadcast is now starting. All attendees are in listen-only mode.
Thank you for joining the How to Be a Good Consumer webinar. Tonight we have presenting with us Michelle Rife. She is the Director of Public Policy at the National Hemophilia Foundation. Michelle brings many years of experience. She's been with NHF for 4 years, and prior to that, she was the president of the Indiana Hemophilia Foundation for 9 years. Michelle, thank you so much for joining us this evening.
Oh, thank you, everyone. Thanks for taking the time to join us this evening. I am, as Janelle said, I'm the Director of Public Policy for the National Hemophilia Foundation, but even more importantly to me, I'm the mother of 2 boys with severe hemophilia, 23 and 18 years old. So the presentation tonight is called How to Be a Good Consumer. Go ahead, next slide. So the first person to help you are the ones who kind of know how it feels to fall down. And I mention this because, again, I am a mom of 2 boys with hemophilia, and I also had no family history of hemophilia, so it was quite a surprise. And I want to say to those of you on the phone, again, the title is called How to Be a Good Consumer, and I would say congratulations, you have already taken the first step by participating tonight. So what is a good consumer? A good consumer is someone who stays informed, makes educated decisions, sets boundaries, and we'll talk a little bit about what that means, and communicates with their family and their medical providers. And I always like to say, remember when, because as I said, I had no family history of hemophilia in our family, and so I remember hearing that my son had hemophilia and still trying to process how to even spell that when I started getting all of these other terms thrown at me. As it was, I was still trying to process the diagnosis, what that might mean for our family, and then I started hearing these terms like HTC, specialty drugs, specialty pharmacy, biologics. And, you know, in this community, we love our acronyms too. So a lot of times people would say SPP for a specialty pharmacy provider, which meant nothing to me at the time. So what I want to encourage you to do is think about your support team, because, again, your support team will help you become a good consumer. So who are the people that would be on your support team? And this would be for emotional support, financial support, but I think of who my support team was. It was family, friends, healthcare providers, and we talk about that with respect to our HTC team members, but also my pediatrician, you know, your chapter, your specialty pharmacy provider, although back when my son was diagnosed, they called them home care providers, manufacturer, and I know this next one will be a shock to you when I say your insurance provider. But over time, I've learned, and I think that we are seeing in the community in general, that our insurance provider can be a good ally for us if we choose to make it that type of relationship. But ultimately, you are the most important part of that team. So what is the role of your support team? If you think about all the different people that were on that list that I just went over, and if you think about what you've needed at different points after diagnosis, you know, there were times you might need emotional support. Like I said, other times financial support, because we all know that time spent in the hospital and away from work can impact our family finances. And then there's the treatment decisions. So who's going to help you decide what therapy regimen to follow? Should you be somebody who does prophylaxis or on demand? What product are you going to choose? And who's going to help you by delivering those products to you? Is it going to be a specialty pharmacy provider, or is it going to be a 340B provider? So one of the first things that I remember having to learn was, what is an HTC? An HTC is your Hemophilia Treatment Center provider, and the HTC network was established in 1975. Initially, there was grant funding from the federal government, from HRSA, for 26 institutions. And early evaluation of those programs found that patients who were seen in a Hemophilia Treatment Center network experienced fewer hospital visits, shorter hospital stays, lower cost of care, less unemployment, because of course being able to have less hospital stays, and a 40% reduction in mortality rates. This was significant at the time because the patients that were being seen typically in a Hemophilia Treatment Center were those who had comorbidities or other healthcare issues such as joint disease, hepatitis. The team at the Hemophilia Treatment Center that is part of the comprehensive care program includes a multidisciplinary team. There's a physician, a nurse, a social worker, a physical therapist, and in some centers there are also an orthopedist. It may not be someone who's on staff, but it may be somebody who works with the Hemophilia Treatment Center on a regular basis. There's a genetic counselor. Again, that might be someone who's just for the center, or it may be a genetic counselor from the hospital where the center is located, a social worker, psychologist, dental hygienist, and also an infectious disease specialist. Again, the physician, the RN, the social worker, the PT, those are your core disciplinaries in a comprehensive center. The others, like I said, are all part of that program, but may be separate from the center. So then we come to, what is a specialty pharmacy? Specialty pharmacy is a pharmacy that provides medications used to treat complex, genetic, rare, and chronic health conditions. And the types of medications that they have are typically not available in retail pharmacies. And it's because they may require special handling or they're high cost. If you think about it, now that you've been diagnosed and you know a little more about hemophilia, you may find that you're one of 3 or 4 people in your community that has hemophilia. So it's understandable that your local retail pharmacy wouldn't stock product because they wouldn't be sure what kind they needed or what the demand would be for it. The services that a specialty pharmacy can provide, which is different than a retail pharmacy, is you'll have access to a specially trained pharmacist that knows about hemophilia and bleeding disorders. They can provide assistance in verifying your insurance coverage and exploring the benefit options. And what we mean by that is, under some health plans, clotting factor is covered as a major medical expense. In other plans, it's covered as a pharmacy expense. And again, that matters to you because it may affect what your cost share is. They also can provide assistance in identifying financial assistance options when needed. They may connect you with someone to help pay your premium or to help pay a copay. They also provide home delivery of the medications and all related ancillary supplies. So for us, that would be our needles, our syringes, in some cases, maybe we have a port and we need saline or heparin. And they typically have the ability to provide home nursing services. Then again, you go, what are specialty drugs? Again, I hadn't heard that term until my son was diagnosed. But specialty drugs are drugs that are used in the management of specific chronic or genetic conditions. They're often injectables or infused medications, but sometimes may also include oral medications. I think of that with respect to oncology. They also typically require some additional education of the patient who's going to be using the medication and close monitoring of your clinical response in collaboration with a physician. Again, I think that most of us could remember the first time that we were infused. Typically happens in the doctor's office so that they can see if you have any sort of reaction to that medication. And then also there's the training piece of that, which is, learning how to self-infuse, learning how to reconstitute your medications. The other thing about specialty drugs is that they may have higher co-payments or require prior authorization before you can order a refill. And they may have specific rules regarding ongoing fills. For example, they may be forbidden from being auto-refilled, which would mean you got your prescription 30 days ago, so on the 30th day they automatically refill your prescription. Typically with specialty drugs, they don't do that. And again, they also require extensive patient education for safe and cost-effective use. You want to make sure that you're using the right dosing so that you ensure that a bleed is stopped effectively and it doesn't continue for longer than necessary. And what is a 340B program? A lot of people use the term 340B and HTC as interchangeable words or acronyms, and they're actually not. A 340B can sometimes be referred to as the Public Health Service Program or the PHS program. And what that is it's a drug pricing program that offers a federal discount to HTCs that receive a HRSA grant and other covered entities. And what we mean by receive a HRSA grant is that they are become a federally recognized treatment center. It means they meet certain guidelines, certain eligibility requirements, and then they're approved to be a federally recognized center. And when we say other covered entities, some examples of other entities that have access to this kind of pricing would be veterans hospitals, children's hospitals, disproportionate share hospitals. And the 340B program was established by Congress as part of the Veterans Health Care Act of 1992. And the intent was that covered entities like HTCs would be able to stretch their resources and provide more services to the patients if they were able to purchase product at a lower price and then put those any profits on those products back into the care of the patients they served. And what does the 340B program do? It allows an HTC to purchase clotting factor for outpatient use, not for use in the hospital, but for outpatient use at a discount. This can result in increased revenue for the treatment centers that can help support better health care outcomes, lower factor prices for patients and insurers, additional resources for the HTCs. I remember when I was told about federally recognized treatment centers or federally funded treatment centers, I thought that that meant the federal government paid for the treatment centers to operate. Over the years, the funding for treatment centers has either remained flat or continued to decrease over time. And so most treatment centers, the federally, the grant funds they receive are less than $60,000 per center. So obviously not enough to fund the whole program. So some of the funding is they are allowed to use to help support the salaries for their nurses, their social workers, physical therapists, outreach clinics, educational programs, And a lot of the HTCs also provide some support to your local chapter. So then you come down to choosing a provider. And if you're not already overwhelmed with understanding what an HTC is and understanding that you can't go to your local pharmacy to get this medication that may be a biologic, may be injectable, and you're still not exactly sure how you're going to manage the disease, now they tell you you need to choose a provider. And that may mean that you can choose a specialty pharmacy provider or a 340B provider. And again, before you make a decision on who your provider is, it's important to ask yourself a couple of questions. First of all, what products and services do I need for my child's care or for my care if I'm the one with the bleeding disorder? For example, does my child am I able to infuse him at home, or am I going to need the assistance of a nurse? Or if I'm an adult, do I have issues with arthritis? Am I going to need a place that can help me secure durable medical equipment like a wheelchair or crutches? Then the other question is, does my insurance plan dictate my choice of providers? And if so, who are the preferred providers? This is becoming more and more critical to know the answer to this question. I remember 23 years ago, insurance companies didn't know much about hemophilia. They didn't know much about the different providers. And so it was pretty simple if your provider was not in network to ask for them to be allowed in network, and typically they were granted access. The reason why it matters to you who a preferred provider would be is that will impact your cost share. So for example, if you have a plan that has a $1,000 deductible for in-network services, those are services that are provided by preferred physicians or programs. You may have an out-of-network benefit that says for out-of-network you have to have a $2,000 deductible and you have to pay 40% of the cost. Or if you're in a health maintenance organization or an HMO, you may have no out-of-network benefits. So it's important to understand who are the preferred providers in your network with your insurance company before you make a choice so that you don't end up with an unexpected very large bill. And then, again, just making sure you understand what that financial responsibility is under the health plan for you. And I like to say we are lucky in this community. We have lots of choices. We have lots of pharmacy providers out there. We also have lots of 340Bs. The question becomes, if my insurance company gives me an option and I have 3 people or 5 people or 7 people to choose from, I would encourage you to interview all of these folks. Again, it's kind of like choosing a child for your school, or a school for your child, where you say, I want to make sure that this school can provide the education that my child needs. Thinking about your provider of clotting factor, you also want to say, can they meet the needs of what I or my child needs? So, for example, some questions that you may want to ask each provider so that you can compare what your options are is, do you have all brands, all the different brands of clotting factor? And do you have all of the different assay sizes available? What ancillary products and services are available? So, for example, do you provide needles and syringes? Do you provide ice packs, nursing services, PT services? And again, asking, are you a preferred provider in my network? It's always good for you to check your own provider network booklet, but it's always good to have it confirmed by asking the provider if they are still a preferred provider. And do you have a financial assistance program or a hardship program to help with copays and deductibles? As we know, for some of us, those copays and deductibles can be pretty high, depending on if it's under major medical or under pharmacy. And unfortunately, we're seeing this more and more too. There is a cost to health care. And so it's important for us to know what that is and know where there might be assistance available should we need help in paying those. And another good question is, how long have you been a provider? Again, I will go back to 23 years ago when my son was born. There were only 2 home care providers that were offered. Now there's many, many more. So a good question is, again, how long have you been servicing the community? There's a lot of different ways that that the relationship between a consumer and a provider can be established. And it's important for you as a consumer to have some reasonable expectations of what that relationship should be like. For example, what are they allowed to do? What are services they're allowed to provide for you? What are things that they're not allowed to do? And this industry-consumer relationship is often governed by laws and or standards. And when we're thinking of what we'll hear most often is the OIG, or the Office of Inspector General. So again, I want to remind everyone that it's important to kind of set your expectations. And what I mean by that is when you choose a provider, once you've made that choice, you want to clearly communicate with that provider what you're going to need, be assured that what they're telling you they can provide, they are going to be able to provide. Make sure that the things you're asking for are realistic and achievable. I mean, that they are things that they are, in fact, allowed to do. And then again, the importance of knowing the cans and cannots for industry members. So let's start with the law. And as I said, this can be by this relationship can be governed by law or standards. But with the law, it's the Office of Inspector General is tasked with regulating the behavior of manufacturers and home cares or specialty pharmacy providers through something called an advisory opinion. In the past, the guidelines were much more stringent on manufacturers than they were on specialty pharmacies. But this has really changed over time, and they're pretty stringent on both groups. So let's start with the manufacturers. You know, the laws, and there's a couple different laws that are out there for manufacturers. One, those that are set by OIG, one that is set by the pharmaceutical industry's advocacy and public policy group called PhRMA. And these laws are intended to regulate how industry interacts with not only medical professionals, but patients as well. So for example, manufacturers are not allowed to give items or support of any monetary nature directly to patients or potential patients. They no longer can just have a lunch or a breakfast or a dinner with a medical professional without there being an educational component of that at that meal. So for example, and we'll get into why they can't do this, but a patient or a manufacturer couldn't, if they were going to be providing some kind of financial assistance with the cost of a drug, that's typically done through a third party. They would not be able to give money directly to a patient. And let's talk a little bit about specialty pharmacy. Some examples of regulations that have been issued by the Office of Inspector General related to hemophilia specifically. There was one in August 30th of 2002, and the OIG issued a special advisory bulletin, and it was on offering gifts and other inducements to beneficiaries. There was also another advisory opinion offered at this, close to that time in September, regarding the provision of certain free goods to individuals with hemophilia. Why are these OIG rules issued? It's because the intent is for them to help give healthcare providers and suppliers a better general understanding of the provisions of the federal anti-beneficiary inducement regulation. And in this advisory opinion that I referenced a moment ago, some of the safety items that were mentioned, because they were looking at what kind of free goods could be given, and specifically this was a request from a specialty pharmacy that went to the OIG and said, we would like to be able to give out these items to members of the hemophilia community. We feel they're valuable and helpful for them, but we want to make sure we are not in violation of any federal laws. And some of the items that they specifically asked about were helmets, knee pads, medical alert bracelets, and pagers. And so the question became, again, what items can a home infusion company provide to patients for free? And what the OIG said is that the description of the item is not going to determine whether or not it's legal to be given to a patient. What does decide that is the monetary value of that item. So what they've said was items of nominal value do not violate the federal anti-beneficiary inducement regulation or the anti-kickback statute. They go on to say that the limits of nominal value are set at $10 per individual item and no more than $50 worth of items per individual per year. So the advisory opinion, the one thing that it did specifically prohibit was the provision of pagers to patients because they exceeded that set financial limit. And years ago, that was kind of a standard. This was before cell phones. It was a standard for you to receive a pager so that your physician could get a hold of you in the event of a problem or your child's school. So I wanted to give some examples because these are the kinds of things that were asked as far as being employees of NHF that were asked about from community members. One of them is, can my specialty pharmacy pay for me to attend a regional or national education meeting such as HFA or NHF? Or does this violate the policies? And the answer to the question is no, they cannot pay for you to attend to those meetings because if the support or gift value is more than $10 per item or $50 per year per person, it would be considered illegal under OIG's guidance. The purpose of this regulation was intended to prevent gifts and payments being given to patients in order to induce them to use a particular product or a particular provider. And this is something that I think a lot of folks are not aware of, and that is, what are the consequences if my specialty pharmacy provider or I break this law? There are fines of up to $10,000 per violation for the specialty pharmacy provider or supplier. If it's determined that the anti-kickback statute was violated, fines, exclusions from Medicare and Medicaid eligibility, and criminal sanctions, including jail sentences, can be invoked upon a party giving or a party receiving that prohibited remuneration. And, it doesn't happen often, but it has happened in our community. I just am sharing with you a couple of headlines from some news articles over the past few years where a provider may have been in trouble for violating the anti-kickback statute, but at the same time, the patients also were determined to be complicit in that and pled guilty and ended up serving some jail time. And here's another example of a program that received a penalty, a very large penalty, for committing Medicaid fraud. So we're going to go back to kind of industry and the consumer. And I mentioned earlier that the guidelines for manufacturers were much more stringent before, and that now they're pretty stringent on both specialty pharmacy and manufacturers. But just to give you an example, for the manufacturers, in 2009, there were stricter guidelines put in place for the manufacturers. And what happened was giveaways started to be scrutinized. And the direction given was that any item not medically based can be construed as inappropriate. Now, I will tell you where this was most noticeable would be when you would go to an annual meeting and you go into the exhibit hall and there used to be all kinds of little tchotchkes and giveaways, or there were great for our kids. Summer camp was like Christmas in the summer. You would go and there would be lots of nice giveaways. There might be flashlights, there might be towels, footballs, squirt guns. Where now all of a sudden you walked in the room and what you saw were Band-Aid dispensers, antibacterial soap, sunscreen. I used to work at a chapter. We ran a camp. Believe me, kids used to be very excited when we would come around to distribute the giveaways at camp. They didn't welcome me so much into the cabin when I was bringing them their Band-Aid dispensers as when I used to bring them their squirt guns. So representatives from these companies are really having to work hard with their legal departments to find out what is okay for them to do and what isn't. For example, in addition to giving giveaways, a lot of industry folks used to volunteer at camps. And now there are some manufacturers or some specialty pharmacies who will not allow their employees to volunteer at camp. Why would that be? Because there could be some liability issues. And legal departments are becoming more conservative because the bottom line is becoming tighter. And I'm sure we've all seen stories on the news of where a pharmaceutical company has been fined a large amount of money that they have to give to the federal government in response to something that they may have done that violated one of these rules. The other thing that I mentioned early on was that there are also standards or guidelines that can determine what kind of relationship there is between the industry and consumers. And the Medical and Scientific Advisory Council, or MASAC, is a medical advisory council that is a committee of the National Hemophilia Foundation that was established in 1954 to advance clinical care and promote hemophilia research. The members of MASAC are scientists, physicians, and other treatment professionals who are internationally recognized as experts in the broad field of bleeding disorders, not only in care but also in research. And what they do is they come together to create quality of care guidelines for treatment of hemophilia and other bleeding disorders. And also those guidelines may be related to whether or not, how you should receive care in an emergency room. They may talk about the importance of prophylaxis or product choice. They meet twice a year to issue and update recommendations. There's also several times throughout the year that they may communicate via email or conference call to review their recommendations. And one of the best known recommendations of NHF is referred to as MASAC 188. And what that is a recommendation regarding the services or standards for services of providers of clotting factor to patients in the home. And what this does is it sets standards for what your specialty pharmacy provider or 340B provider should be able to do in servicing your needs. So for example, it requires that there is a physician, or a pharmacist available 24/7 for you to call if you have questions. They should be able to deliver factor to you in the event of an emergency within 12 hours. They should stock or have access to all of the different brands and assay sizes. They should be able to provide you the ancillaries that you need. They should also be able to work with your provider when you have issues or concerns, and as I said, be able to have an emergency plan in place in the event of some sort of national disaster. How would they still be able to get product to you? We talk about this a lot, and you'll hear about this a lot in our community when we talk about MASAC 188. And currently, this is a recommendation of MASAC, and it's something that specialty pharmacies and 340Bs self-report compliance with. So in other words, you can go on NHF's website and you can look up under advocacy and under MASAC, you can look up this provision, and it will also give you a list of all of the specialty pharmacy providers and 340B programs that have self-reported to us that they meet those standards. That's important for you to know, and it's important for you to know what those standards are, because if you are utilizing a provider who maybe is not getting your factor to you on time, or they're sending you the wrong supplies, or they're sending you, maybe even the wrong assay sizes, it's always good to ask them, do you meet MASAC requirements? And if they say that they do, and you're still seeing that you're having these problems, then it's kind of our responsibility as patients to say to the company, to hold them to those standards and say, you say you can meet these standards, this is what I need. And if they can't, you always have the option of trying to find someone else that can meet those needs. Now let me just say that can be a challenge in today's environment, and even going forward it's probably going to become an even more difficult challenge as insurers continue to narrow their networks. But let's say you're in a plan that your health plan only gives you one option of a provider, and that provider says that they meet these guidelines, but yet you're always waiting for your product. It never comes in the right vial sizes. There's always errors with your ancillary supplies. These are important things to note, because these are the times where your insurance provider may be willing to make an exception for you to be able to get your services from someone else, because you can go back and you can say, here are guidelines that they've said they've met, and they're not meeting those guidelines, and it's impacting my access to care. Then they may be willing to give you that exception to allow you to go to a different provider. So I believe that Janelle is going to make available to you a copy of the MASAC guidelines. She is also going to provide you with a document that we call provider questions. You'll see it's a two-sided document. On one side, it has a list of questions for you to ask potential pharmacy providers. On the other side, there's a list of questions to ask your insurance provider. Because again, remember, before you go out and start trying to identify, who you would like as a pharmacy provider, you should first check your insurance company and see if they have rules surrounding who you can and cannot use. So I would say some parting thoughts to remember is to choose your support team wisely, educate yourself, ask questions. All of the team members that I listed earlier are valuable resources, but you should know the do's and don'ts that apply to those different resources. And you should communicate your expectations to all of those folks as well, and also set boundaries. And what I mean by that is when you think about, maybe I need some some financial support. We've hit some hard times. We've had some hospitalization. Who would I go to ask for that support? That might be my family. That might be my friends. That might be my chapter. It could be my specialty pharmacy provider or manufacturer because they have assistance programs. Probably wouldn't be the insurance company. Probably a better example is I'm trying to make a decision about what product to use. You know, who would I trust to help me do that? Might be my physician. You know, my family might have a say in it. My friends probably aren't because they don't necessarily know what you know might be best for me as far as treatment options. Sometimes the insurance provider tries to dictate what your treatment regimen should be. But again, recognizing that there are different roles that each one of these team members kind of fills for you. And to remember that you are your best advocate. If there's something that you need that you're not being able to access and somehow you're being prevented from doing that, again, reach out to one of the national organizations, reach out to your provider, reach out to your insurer. There are lots of people who can help you, but they can only help if you ask for help. And the other thing is to remember that you have the right to hire or choose a specialty pharmacy or 340B program, and you have the right to fire or change those providers as well, as long as it's within the restrictions of your insurance company. But you do have the right to expect a certain level of service if that's what's been promised to you and if it's not being delivered. So I think with that, I think we can open this up and see if there's any questions from anyone.
Absolutely. Michelle Rice, thank you so much for that very informative presentation. We are going to attempt to open the lines up for questions. If we do face any difficulties, please type your questions and I will ask them to the presenter. This presentation is also being recorded, so it will be available on the HFA website, or we may convert it to a YouTube video. So we have no hands raised. Does that mean that it was very informative? Are there any standard questions that most people would ask?
I think that one of the questions that we get a lot is similar to what I just mentioned earlier, where your insurance company states that you only have one or two choices, and you find that those are not qualified providers. And so, you know, there is a way that you can ensure that, you know, those issues are addressed by being very consistent with tracking those problems. For example, if you're having issues where your product is coming late, make sure you write down the date and the time that happened and what exactly was wrong. Or if there's something that's delivered to you incorrectly, again, make a note of those things. Make a note of the date, the time. If you share those things with your insurance provider, chances are you will have, if it's well documented, you may find yourself being able to get an exception to obtain better service.
Okay, great. Now we do have a question, and I think that I have lost the question.
The question over on the icon. Oop, didn't stay up.
All right, well, thank you very much. If there are additional questions, please send them over You can send them directly to Michelle Rice, or you can send them to HFA, and we'll make sure that we get those questions responded to. Please look out for the supplemental materials. And again, this webinar is being recorded, and the information will be made available. Thank you all very much, and have a great evening.